really, it's important to know the national projections. One is that there may be regional differences that we may not be aware of. This helps acute care facilities, health systems mobilize resources that they may need to do to combat some of the spread of the resistance in their own areas. Also for public health agencies as well, is to really mobilize their resources, whether it's at local county levels, state levels, or at national levels. So this type of data really helps provide a glimpse as to how much are healthcare associated infections, which are a set of resources you would allocate and within the acute care setting. But if we're seeing resistance in the non-acute care setting, then it's a different type of perspective that one may need to approach from a healthcare facility perspective, as well as overall from public health as well. So we used our BD microbiology research database, and that's the Becton Dickinson database. And the reason for this is that we have very rich and robust data within our database. Database has not just data on hospital onset isolates, but also overall from an admission period and also from an ambulatory perspective. There's very few databases out there that really provide a comprehensive view of how many pathogens are collected, what the results of those pathogens are in these types of different settings overall. So this afforded us an opportunity to really look at the data to be able to not just look at observed cases, but also use statistical methodologic techniques such as raking methodology that we use to do national projections. The other aspect that's unique to the database is that microbiology data can be very textual. Many different ways that these pathogens can be called pathogens. So for example, Staph aureus can be over 100,000 ways Staph aureus is called Staph aureus. So the uniqueness in the BD database is that all those pathogens and susceptibilities are mapped and organized to a common standard. So it allows us to query much more readily to be able to do these types of analyses.